Hey, it's Allison. I'm a death doula, grief educator, and coach, as well as an end of life services planner. Today, I want to talk about the differences between palliative care and hospice care and the doula's role within that space. So often, people, when they hear that their loved one is going into palliative care, they automatically assume that it is hospice care, and that is not the case. They often get that confused. Palliative care is actually for any stage of illness after the diagnosis, and the aim is to improve the quality of life while undergoing treatment to extend their life. So, to talk about pain management, the hope for a cure, or a resolve of their illness. Whereas hospice care is focused on providing support when a patient has reached an incurable point of their illness. And both could be palliative and hospice care could go on for long periods of time. However, the goal of hospice is to ensure that the person's end of life is as dignified as possible, where palliative care kind of focuses on trying to make the person better. Um, Both palliative and hospice care medical teams are made up of physicians, social workers, spiritual counselors, grief support, and also a death doula or an end of life doula can fit in within all of that. And how an end of life doula can fit in is not to take the place of any of that, but to kind of be the filler or the glue in between all of that. When a family and an individual is having to make decisions about palliative care, about hospice care, there are multiple stressors that are happening. There's the emotional stressor, there's the financial stressor, there's the accessibility stressor, and then there's also just the knowledge stressor when we are in fight or flight or freeze, which often happens when we've got a diagnosis such as cancer or some life-threatening disease or condition, it is hard to make those decisions objectively because subjectively we love our person and we only want the best and that we want them to be around, right? And so a doula can, one, provide education, can help provide an objective point of view to help make the right decisions for your family or for that individual. Number three, we can also be an advocate. We're trained and to understand what questions we should be asking. We can help record those questions or the answers to those questions, and help be an advocate through all of that and be a voice. End of life doula can also provide emotional support in the midst of all of that. And we can be there for longer periods of time than the medical team or the social worker team. Our insurance systems, particularly in the United States, aren't geared towards spending nurturing time and individual customized time with patients. Whereas an end of life doula, we can create as much time as we need or want to with our clients. We can spend customized and nurturing times with our people for as long as they need, and that can fit within what we're providing as a service. So I hope that you found this helpful. If you have any other questions about palliative care and hospice care and how a death doula can be of support to you, you can sign up for my newsletter, or you can just DM me and I'll provide you tools and resources that you might find helpful for your particular situation.